Today will be
same to you, ma'am.
Yeah, thank you, thank you. Okay, so now we'll be heading to another system. We have been seeing a few systems. Now we'll be heading to another system, that is endocrine system, which is one of the important systems, like how nervous system was. Okay, and each system has its own importance. Okay, and endocrine system also has its own specific importance. Now moving on to explore the anatomy and physiology of endocrine system. Before we actually go into endocrine system proper, हमें ये देखना चाहिए कि gland क्या होता है. Okay? So a gland is an organ which secretes particular chemical substances, okay, for use in the body or for discharging into the surroundings. Okay, so a gland, like हमें पता है कि plants, they they give seeds, or they bear fruits, they bear seeds, etc. Similarly, what does this particular gland do? Gland is basically a structure which secretes some type of chemicals. Okay, it may be discharging into the surroundings or discharging into itself. So based on this, glands are of three types: exocrine gland, endocrine gland, and heterocrine gland. Okay, three types of glands. So endocrine, exocrine, and heterocrine glands. So what are endocrine? We'll first see exocrine, and we are going to study in detail about endocrine glands. तो हम exocrine gland को duct gland भी कहते हैं. Glands with ducts, इसको हम duct gland भी कहते हैं. And endocrine glands are called as ductless glands. Okay, ductless glands. So when we studied about female reproductive system, हमने mammary glands को देखा था. तो हमने वहाँ पे पढ़ाई की कि lactiferous ducts. Okay, so ये जो lactiferous ducts, so what happens through the alveoli, it comes out through lactiferous ducts, and through lactiferous ducts it comes out through the areola and through the nipple. So exocrine glands are glands that secrete their products into ducts. Like हमें घर के अंदर जाने के लिए कुछ डोर रहता है या कुछ एंट्री पास रहती है, वैसे it's some structure through which the secretions from that gland have to pass through. So examples for exocrine glands are sweat gland, salivary gland, mammary gland, stomach, and liver. Okay, stomach and liver we don't consider much, but sweat gland, salivary gland, and mammary glands. So these three glands are glands with ducts or the duct glands. ठीक है, इनका जो भी secretions आता है, it has to pass through the duct and then get emptied out. ठीक है, and may not be necessary the sweat gland, salivary gland, and mammary gland. They don't enter into the bloodstream. Exocrine glands, they don't enter into bloodstream. Endocrine glands, they directly empty into the bloodstream. Okay, तो हमने sweat gland को देखा है कि apocrine gland, eccrine, apocrine gland. अगर आपको integumentary system थोड़ा कुछ आप रिवाइज अभी रिकॉल कर सकते हैं, तो eccrine, apocrine gland को हमने देखा था कि sebaceous gland से बाहर आता है और एक ऊपर रहता है, एक नीचे रहता है. Okay, and eccrine sweat gland का ही इमेज है यहाँ. ठीक है. Next, coming to endocrine gland, important glands, and which we are going to study in detail. So endocrine glands, glands that secrete their hormones directly into blood rather than through a duct. So pituitary gland is an example. Pancreas is an example of an endocrine and an exocrine gland. Thyroid gland, adrenal gland, many other systems we are going to see in detail. Okay, so major difference. There are three types of glands. Basically, gland क्या है? It's an organ. It's a structure formed of tissues. इससे कुछ secretions बाहर आते हैं. Few secretions come directly into bloodstream. Few secretions come outside, or few glands have ducts. Few do not have ducts. So major difference between endocrine and exocrine. अभी हमने और एक देखा था कि heterocrine. Heterocrine gland वो होता है जिसके अंदर endocrine gland भी रहता है और exocrine gland भी रहता है. ठीक है? Now going to heterocrine gland. So one such example of heterocrine gland is pancreas. It has both exocrine gland and an endocrine gland. It has functions of both exocrine function and endocrine function. हम आगे देखेंगे. Endocrine system consists of glands and group of capillaries which facilitate diffusion of hormones to bloodstream. Okay, so endocrine glands, the secretions from this, you can see this image. See, this is the gland. Through the gland, it is directly coming into the bloodstream. There is no structure in between. Okay, so it is directly entering into the bloodstream. Okay, and these glands are also called as ductless. I told you they are ductless glands. Okay, endocrine glands. So which are the endocrine glands in our body? So here you can see hypothalamus, which is the master gland. Hypothalamus is the master gland. It controls all the other glands present in the body. So hypothalamus is an important gland. Hypothalamus को हम master gland कहते हैं. Hypothalamus के अंदर there are बहुत सारे organs है या glands है which are under control of hypothalamus. Hypothalamus के बाद और एक important gland है, that's pituitary gland. Pituitary gland. Okay. हाइपोथैलेमस से सिग्नल्स पिट्यूटरी को मिलता है, पिट्यूटरी से थायराइड को जाता है, ओवरीज को जाता है, एक्सेट्रा. ओके, हाइपोथैलेमस, पिट्यूटरी ग्लैंड, पीनियल ग्लैंड, ये तीनों दे आर प्रेजेंट इन द ब्रेन. ओके, पीनियल ग्लैंड मैंने ज्यादा एक्सप्लेन नहीं किया है. आई विल जस्ट टेल यू अबाउट पीनियल ग्लैंड. पीनियल ग्लैंड इज अ पी शेप्ड स्ट्रक्चर प्रेजेंट इन द ब्रेन. इसका जो सिक्रीशन है, इट इज रिलीजिंग मेलाटोनिन. It is releasing melatonin and it is concerned with the sleep. अगर melatonin अच्छा release हो रहा है तो it is concerned with the sleep. It maintains the circadian rhythm of the body. The sleep and wake cycle को pineal gland maintain करता है. And इसका ज़्यादा functioning is not explored in the medical system. Now concentrating on the two glands present in the brain, that is the hypothalamus and pituitary. Hypothalamus and pituitary. ठीक है? Next. Brain में we have three glands, that is hypothalamus, pituitary and pineal gland. Next, coming to the next structures. Yes, next structures में क्या है? Thyroid. सबको पता होगा ना thyroid. Is there anybody who is not aware about thyroid? And among the viewers here, how many of you have got your thyroid blood test done?
Me.
Okay, somebody said me. Other than me, anyone else has done? Okay, so
Yes.
Okay, Nivedita also says yes. It's okay. Yeah, thank you, Saisha. So thyroid is a gland. So all of you who got your blood test done for thyroid, it tells us about the hormones which are secreted by that particular gland. So there are T3, T4, TSH. Okay, so T3 and T4 are basically from the thyroid gland. So there we are actually checking the functioning of that particular gland. Okay, next, thyroid gland. Iska posterior aspect of thyroid gland, we have parathyroid gland and another structure thymus, which is present in childhood and it goes off by adulthood. Okay, next, so these were the structures. So there are three glands present in the brain, that is hypothalamus, pituitary and pineal gland, and in the neck, thyroid, parathyroid and thymus gland. Thyroid, parathyroid and thymus gland. Next, moving on to abdominal organs, we have pancreas. Okay, so can somebody tell me pancreas is in relation? When I say pancreas, what strikes to your mind? When I say pancreas, what strikes to your mind? You can just write it down.
Digestion system.
I didn't get
Glucose.
Very good. Digestive
Glucose.
system, somebody said yes. Glucose, correct. Very good.
Sugar levels.
Very good. Insulin, very, very good. Yes. Karan is the message if he's logged in. Insulin, very good. Kanchan also says insulin. Yes. Anybody else? Yes. All of you have told correct things. Okay, rightly pointed. So pancreas, very necessary for insulin, diabetes mellitus type 2, type 1. Okay. Next. So in the abdominal region, we have pancreas and adrenal glands. हमने excretory system पढ़ा है ना किडनी के बारे में. तो किडनी के ऊपर उसी दिन जब हम डिस्कस कर रहे थे किसी ने बोला था एड्रिनल, तो दोनों किडनी के ऊपर ओके फाइन, दोनों किडनी के ऊपर एक ग्लैंड रहता है. आई मीन ईच किडनी हैज ईच एड्रिनल ग्लैंड. एक किडनी के ऊपर एक एड्रिनल ग्लैंड रहता है. सो देयर आर अ पेयर ऑफ एड्रिनल ग्लैंड्स. ओके, then a pair of ovaries. तो हमने देखा था ovaries prepares the oocyte and oocyte is taken by the fimbriated end of fallopian tube and it is taken to the uterus. वहाँ पे implantation होता है. तो ovaries, we studied about estrogen and testosterone. Okay, all that you should recollect that. Okay, estrogen, progesterone in females. Okay, next placenta हम इस क्लास में नहीं पढ़ेंगे. Okay, next coming to testicles. Testicle के बारे में भी हमने पढ़ा है. ठीक है. Okay, now moving on to functions of hypothalamus. So just a quick revision. Glands present in the brain, hypothalamus, pituitary and pineal gland. Pineal gland के बारे में हम ज्यादा explore नहीं करते. Explore करने का दो topics है, hypothalamus and pituitary. Next coming to structures of the neck, thyroid, parathyroid and thymus. Next coming to pancreas, which tells or wherein we study about the functioning of the hormones which are secreted by pancreas. Next ovaries and testicles, उसके बारे में हमने पढ़ा है. ठीक है. And adrenal glands present over the kidney. Okay, I'll just keep the slide open. Type 5 glands name and send it to me back. Type 5 glands name and send it to me back. Fast, all of you.
मैं बोल दूं मैं?
हाँ, बोल दीजिए.
Okay. In mind, there are three glands. One is hypothalamus, pituitary, pineal. Then thyroid, parathyroid, thymus, and then pancreas, ovary, adrenal. Okay.
Okay, good, good. Anybody else wants to try or wants to message? Yeah, Karan says pituitary, pineal, thyroid, adrenal, reproductive. Okay. If anybody's answering, we'll wait or else we'll.
In the brain, we have hypothalamus, pituitary, and pineal gland.
Okay, good. Pituitary, thyroid, parathyroid. Two pituitaries. We have only one pituitary gland, pineal. That's cool. Okay, we'll move to the next slide. Yes. So coming to the master gland, that's the hypothalamus. Hypothalamus is a part of the brain present in the posterior part of the forebrain. So when we studied about the brain, I didn't explain this concept. Forebrain, midbrain, hindbrain. Okay, forebrain, midbrain, and hindbrain. So this is present in the posterior part of the forebrain. Connects the midbrain with the cerebral hemisphere. Connects the midbrain with the cerebral hemisphere and encloses the third ventricle. So you can just ignore the ventricle part, but it's remember hypothalamus is a part of the brain. Okay, hypothalamus is a part of the brain. So, and this hypothalamus organ has control over all the rest of the organs present in the body, or 80% of the organs are under the control of hypothalamus. We will see how. Okay. Now, secretion of posterior pituitary hormones. Now, we have to see the hormones which the pituitary gland will secrete. Okay. We'll do one thing. We'll study pituitary and hypothalamus side by side simultaneously. Okay. So next coming to pituitary gland. So pituitary gland is having two lobes. Pituitary gland is having two lobes, anterior lobe and posterior lobe. Anterior lobe, the lobe which is slightly larger, posterior lobe which is slightly smaller. Okay. And another lobe in between, that is intermediate lobe. Anterior lobe, posterior lobe, and intermediate lobe. Anterior, posterior and intermediate. Anterior lobe जो है वो बड़ा है, posterior lobe थोड़ा छोटा है, intermediate that's very small. Okay, so a pituitary gland है, present in sala turcica of brain. Remember, it's in the brain. Okay, so the what you can see of the big structure, that's the anterior pituitary. The smaller structure is the posterior pituitary. So this whole thing is anterior pituitary. This whole thing is posterior pituitary. In between This whole thing is the intermediate lobe. Intermediate lobe. Now we will see इनका function क्या है. Okay. So pituitary gland. मैंने बोला था जो लोब बड़ा है उसे हम एंटीरियर कहते हैं, जो लोब छोटा है उसे पोस्टीरियर कहते हैं. ठीक है. सो नाउ यू रिमेम्बर एंटीरियर लोब और पोस्टीरियर लोब के बीच में एंटीरियर लोब बड़ा है, पोस्टीरियर लोब छोटा है. And you can see on top, the topmost notch, where the image he tells he has put hypothalamus here, and hypothalamus anterior or posterior pituitary को control करता है. Hypothalamus controls anterior and posterior pituitary. In turn, anterior and posterior pituitary controls all the rest of the organs. तो आप अभी देखेंगे. Now see. ग्रोथ हार्मोन क्या है? ग्रोथ हार्मोन इज वन. हम यहाँ देखेंगे कि there are 6 hormones released by anterior pituitary. Anterior pituitary releases 6 hormones. Okay, anterior pituitary बड़ा है, it is big in size and it releases 6 hormones. Posterior pituitary size में छोटा है, it releases 2 hormones. Okay, anterior pituitary, posterior pituitary. Anterior pituitary से 6 हार्मोन आ रहे हैं, posterior pituitary से 2 हार्मोन आ रहे हैं. तो एंटीरियर पिट्यूटरी से ग्रोथ हार्मोन जब रिलीज होता है, दैट ग्रोथ हार्मोन इट गोज एंड रीचेस द बोन्स. मेजर इम्पैक्ट ऑफ ग्रोथ हार्मोन इज ऑन द बोन्स. तो anybody who is of tall stature, extremely tall or extremely short, so that is problem with the growth hormone which is supposed to have an impact on the bones. This impact on the bone, how it has happened, it is through the anterior pituitary. This anterior pituitary in turn has control over hypothalamus. Okay, so this is a stepwise method. अगर आप कहीं इंस्टीट्यूट पे काम कर रहे हो ना, आई एम नॉट वर्किंग फॉर द व्हाट यू कॉल, I don't know about the functioning at an MNC level, but if you just take an example of a school, just if you take an example of a school, what happens? A student wants a leave, so then he might write a school which has too much of rules and regulations. So बच्चा क्या लिखेगा? He will write a leave letter to his class teacher. Class teacher will further send it to the coordinator, who is the coordinator for those classes. Coordinator further he will send it to principal. अगर principal बोलेगा लीव दे दो तो इन सबको लीव मिलता है, या it is under control, step by step method. तो growth hormone जो रिलीज हो रहा है, तो this growth hormone which is released by anterior pituitary, इसका कंट्रोल कहाँ है? हाइपोथैलेमस में है. हाइपोथैलेमस बोलेगा रिलीज करो तो रिलीज करेगा. Then when it is released, वो कहाँ जाएगा? It will go to the bones. अगर ये ज्यादा सिक्रेट होगा तो भी प्रॉब्लम, ये अगर कम सिक्रेट होगा देन आल्सो इट्स अ प्रॉब्लम. ओके, देयर आर समथिंग कॉल्ड एज जायंट. हम किसी को बोलते कि ही इज वेरी जायंट और ही लुक्स जायंट, so that giant is nothing but gigantism. Okay, somebody who looks very, somebody who's of short stature. I've seen recently in some TV show a girl of 16 years old looked very young. Okay, she looked as though she's some 8 years 9 years old. So dwarfism. Next, again there is prolactin which is secreted from anterior pituitary. Again uska control, it's an hypothalamus. Prolactin acts on the breast. Again estrogen and progesterone secreted by anterior pituitary, their action on ovaries. Okay, secretion of FSH, their action on testes. Secretion of adrenocorticotropic hormone ACTH, action on adrenal cortex or the suprarenal gland. Thyroid stimulating hormone released by anterior pituitary, its action on the thyroid gland. And so this completes the 6 hormones. This completes the 6 hormones. Just go through this. Growth hormone has an impact on the bones. Prolactin has, growth hormone has an impact on bones. Prolactin has an impact on mammary gland. Luteinizing hormone has an impact on ovaries and testes. Follicle stimulating hormone has an impact on ovaries and testes. हमने पिछले क्लास में पढ़ा है. Adrenocorticotropic hormone has an impact on cortical hormones. Thyroid stimulating hormone has an impact on thyroid gland. Okay, so we have 6 hormones released from anterior pituitary. इनका functioning किसके अंदर control है? It is controlled by hypothalamus. Okay, so after we know that there are 6 hormones secreted by anterior pituitary and 2 hormones by posterior pituitary. 6 hormones by anterior pituitary, 2 hormones by posterior pituitary. ठीक है. what are the two hormones that are secreted by posterior pituitary? Posterior pituitary is one is ADH, antidiuretic hormone, or vasopressin, which has an impact on the kidney. Another one is oxytocin, which has an impact on the mammary gland. Can somebody tell me what is the impact on mammary gland oxytocin? We studied on mammary gland there are two hormones, oxytocin and prolactin. Prolactin is from the anterior pituitary, oxytocin is from the posterior pituitary. I will give a hint. Prolactin helps in the synthesis of milk. What does oxytocin do? Okay, I'll ask this function in the next class. No, Karan, no, it's wrong. Okay, I'll give you a hint. It is opposite of stoppage. It is opposite of stoppage.
Flow.
Yeah, it helps in the exit. It helps in the
Heavy flow.
evacuation. No, it helps in the evacuation. It helps in the ejection. The better word is ejection. It helps to eject out. It helps the see, prolactin helps in the synthesis of milk. The milk has to come out. So there is a signal which is sent. Okay, when there is sucking reflex by the baby, then oxytocin tells there is a need of the milk. So oxytocin releases the milk. Okay, at least female should concentrate and listen. Now we studied that there are 6 hormones released by anterior lobe of pituitary. Pituitary gland has 2 lobes, major and 1 lobe smaller. That is, one bigger lobe is anterior lobe and it has 6 hormones. One smaller lobe, that is posterior lobe, has or releases 2 hormones, and a lobe in between them is intermediate lobe, and it is concerned with the MSH, melanocyte stimulating hormone. Melanocyte stimulating hormone. So this growth hormone, anterior lobe, say we saw there were 6 hormones that they are released. What are the 6 hormones? Growth hormone, prolactin, thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone. So I think I have briefed their functions in the previous slide. Okay, MSH, melanocyte stimulating hormone, is concerned with the melanin pigment present in the skin. You have seen about vitiligo patients or people with white skin, abnormal white skin, somewhere on the hand, on face, etc. So in them, it is the melanin which is less, and that melanin is under the control of melanocyte stimulating hormone in pituitary. Okay. Next, posterior lobe, vasopressin, which has its impact on kidney, ADH, oxytocin, which has its impact on the uterus and also on the mammary gland. So to be clear, anterior lobe has 6 hormones, posterior lobe has 2 hormones, intermediate lobe being smaller. आप ये कैसे याद रखो? See, anterior pituitary, posterior pituitary and intermediate. Anterior pituitary बड़ा है तो 6 hormones निकल रहे हैं. Posterior pituitary छोटा है, 2 hormones. Intermediate, the smallest, and 1 hormone is released from intermediate lobe. Anterior lobe, posterior lobe, and intermediate lobe. Now we know, or we have studied, that there is growth hormone which is secreted from anterior lobe of pituitary. So what does this growth hormone do? Stimulation of growth of bones, calcium, and connective tissue. So the somatomedins are synthesized in the liver in response to stimulation by the GH. If GH gives a signal to the liver, then liver will produce somatomedins, and these somatomedins are helpful in the growth of the bones, growth of the bones. Okay, so we studied about skeletal system. Okay, so it helps in the growth of bones. So in general, growth hormone is concerned with the growth of bones. Effect on protein and mineral metabolism. So on protein metabolism, it is anabolic in nature. So anabolic in nature is, it is constructive. It is constructive in nature. It helps in building the blocks. Coming to mineral metabolism, what does it do? It increases calcium absorption from gastrointestinal tract. Okay, so in the presence of growth hormone, what is happening? It is absorbing. अगर growth hormone ठीक तरह से release हो रहा है, तो calcium is being absorbed from the gastrointestinal tract. अगर growth hormone is inhibited, then calcium will not be absorbed from GI tract. Okay, then it further decreases sodium, potassium, calcium, and phosphorus, which are supposed to be excreted from kidney. Okay, which are supposed to be excreted from kidney. Okay, sodium, potassium, calcium, and phosphorus excretion from kidney. So the last point you can keep it in your subconscious memory. Remember that mainly growth hormone is helpful in calcium absorption from GIT, and also it helps in, or the somatomedins mediated by a liver help in the synthesis of calcium. Okay. Next, effect on carbohydrate and fat metabolism. So this growth hormone is diabetogenic because it produces hyperglycemia. Remember, hyperglycemia. Okay. Next, on fat metabolism, what does it do? It moves the fat from its place. Or see, the fat which is there, the extra amount of fat food, the like proteins, vitamins, minerals, fats, whatever we eat, that extra amount of fat is stored in the form of adipose tissue. So what does this growth hormone do? It goes to the adipose tissue and it breaks that adipose tissue down, or it reduces it into simpler substances so that it is broken down. It is broken down. So that is an important function of this growth hormone. Okay, it breaks down the adipose tissue. So once this adipose tissue is broken down, it mobilizes. Once it is mobilized, it prevents conditions like dyslipidemia, etc. Okay. Now, growth hormone is under control of hypothalamic hormone. Growth hormone releasing hormone, growth hormone inhibiting hormone, GHRH and GHIH. So I told you, growth hormone or the hormones of pituitary are under the control of hormones of hypothalamus. So the regulation, releasing hormone, inhibiting hormone, releasing hormone, inhibiting hormone. GHRH tells release GH, GHIH tells stop releasing GH. Okay, inhibiting, it inhibits, it suppresses. GH releasing hormone, it releases. Now, when does this GHRH release? During exercise and during stress. Okay, so this you can think secretions by stimulating GHRH release. Example, during exercise. See, we ask people to exercise to improve their growth. What is happening there? It is having an impact at the level of growth hormone. It's having an impact at the level of growth hormone. Now, diseases in relation to growth hormone. I will just run past these slides. It is for your information. Gigantism, it is due to overproduction of GH. Gigantism. Okay, the person is extremely tall and fat. Okay, so you can see this image comparative. Okay. Next, there is another important finding, that is bilateral gynecomastia. So this bilateral gynecomastia is due to, or is the presentation of mammary glands in male patients. Presentation of mammary glands in male patients. That is one more feature or presentation seen in gigantism. Gigantism, one is the build is tall and width is also more. So there's tall stature and the body girth also is more. Next, bilateral gynecomastia, that is there is mammary glands development is there in the male people, large hands and feet. Just imagine, you might have come across many caricatures. So similarly here, go through some app, and if there is some app to make somebody giant, okay, then however that person looks, it is the same, gigantism. When growth hormone is secreted more. Again, another condition, acromegaly, wherein growth hormone is secreted more. So here, the thing is, broad thick nose, thickening of the skin, it increases the thickening of the skin. Another important finding, prognathism. You can appreciate prognathism here. See this particular jaw. It is abnormally long and wide. It's abnormally long and wide and protruded. That is prognathism. That's prognathism. Okay. So growth hormone. See, the intention of putting these here is, so if these hormones are increased more, also there's a problem, or if they are secreted less, also it's a problem. So we saw two conditions which are due to excessive secretion of growth hormone. One is gigantism, the other one is acromegaly. Next, coming to dwarfism. Deficiency of growth hormone secretion, shortness of stature, small genital area, and delicate extremities. So he will not be able to perform the activities like how we do. He will not be able to perform, or the strength which is needed will not be able to do. He may not be able to carry a bucket of water. He may not be able to carry a brick. Okay, because his stature does not permit, does not support. Okay, shortness of stature. So gigantism, dwarfism is an effect of both growth hormone. It is secreted in excess, secreted less. So one thing, growth hormone is a hormone secreted from anterior pituitary, which is under the control of hypothalamus, growth hormone releasing hormone, growth hormone inhibiting hormone. Okay. Coming to prolactin, all of you know in the previous slide while explaining also I told you, prolactin secreted from anterior pituitary has an impact on the mammary gland, and it helps in the synthesis of milk. It helps in the synthesis of milk. Whenever a lady gets pregnant, it is the prolactin which is activated, and that's how there is breast milk secretion. Okay, in us, in the people who are non-pregnant or who are not on the verge of, or who are not the nursing mothers, in them prolactin is suppressed. Prolactin is suppressed. If that is not suppressed, then you will have mammary, through mammary gland you will have breast milk secretion. Another important, thyroid stimulating hormone, TSH, thyroid stimulating hormone, an important hormone secreted from anterior pituitary. So it TSH, this TSH tells the thyroid gland, it has an impact on the thyroid gland, and tells thyroid gland you secrete hormone triiodothyronine and tetraiodothyronine, or thyroxine. So TSH gives a signal, TSH from anterior pituitary gives a signal to thyroid gland saying you secrete T3, you secrete T4. If TSH says stop, then it will stop secreting T3 and T4. Okay. Many a times when we send people for thyroid profile test, it is T3, T4 will be normal, TSH will be abnormal. So use correct TSH, T3, T4 will still be normal. Okay. Adrenocorticotropic hormone, ACTH, that will have an impact on the, or that will release corticosteroids. We'll not deal with this much. Okay. Follicle stimulating hormone, we have come across this. Follicle stimulating hormone regulates the development, growth, pubertal maturation, and reproductive processes. So major thing here, which we studied in the last class. So follicle stimulating hormone helps in the formation of follicles, helps in the formation of follicles in the ovaries. LH. Now, due to FSH, due to follicle stimulating hormone, there are follicles which are formed. There are some circular structures which are formed. Okay, what you can correlate this is, you need certain conditions which are suited for the seed to sow. When you are sowing the seed, you need certain conditions. Okay, and you also need certain conditions for the seed to sprout. Okay, one thing is, assuming you want a mango plant, you are going to sow the seed. Okay, to sow the seed you need certain atmospheric conditions. Okay, one part. The other part, the seed should rupture and it should come as a sprout. When it comes as a sprout, it is capable of yielding. Mango tree will yield if it sprouts and grows, and it will then give mango fruits. Similarly here, the seed what you sow for a mango, similarly it is the ovum which is formed. So for seed, when you're sowing the seed, you're giving certain climatic conditions or the quality of the soil, etc. So similarly here, the ovum, the formation of the oocyte is through the effect, or the what for the seed to sow, what all conditions you are considering. Here it is the follicle stimulating hormone. Now the sown seed has to rupture and come out as a sprout. So similarly, it is the LH which helps in ovulation. It helps the follicle to rupture and the ovum to release. So similarly, there is extreme heat. In case of a mango seed, there is extreme heat and certain climatic conditions required for the seed to rupture. So that is nothing but the LH. That is nothing but the LH. And I am giving you this example even on the day of ovulation. So what happens? Ovulation is nothing but the matured Graafian follicle is going to rupture. When it ruptures, then it's going to release the ovum. So similarly, when you do, how many of you are familiar with sprouts? I think Saisha, Saraswati Nair will be familiar. Sprouts.
Yes.
Yes. So this, can somebody type, or can somebody unmute and immediately tell me how sprouting happens, or how you want, assuming you want green gram sprouts, how do you do it?
Ma'am, soak it for 5 hours in water, then drain the waters and tie it in a cloth and keep it in a dark and warm place.
Okay, yeah, you're keeping it in warm place. So similarly, you need heat for it to sprout, right? Hmm? You need heat. You are going to tie it in a cloth. You're going to tie it airtight. You're tying it airtight and keeping it in a closed box so that there is less of of that coming in contact with oxygen. So certain conditions are needed. Similarly, LH provides certain conditions, and you can observe for people who want to conceive. We ask them to check their basal body temperature (PBT). While on the day of ovulation, there is increased body temperature. There is increased body temperature. Here also we need heat. There is increased body temperature. So it is LH which does the ovulation, And in males, this LH helps in the production of testosterone. Okay. So these were the hormones secreted by anterior pituitary. There are 6 hormones secreted by anterior pituitary. Now let's see how it's under the control of hypothalamus. I'll just zoom this slide, just go through this important part of anterior pituitary and posterior pituitary. I'll just give a quick revision. Hypothalamus controls anterior pituitary and posterior pituitary. And these 2 lobes of pituitary have an impact on the rest of the organs. Okay. Anterior pituitary is a growth hormone, prolactin, LH, FSH, ACTH, and TSH. I will elaborate: luteinizing hormone, follicle stimulating hormone, adrenocorticotropic hormone, thyroid stimulating hormone. So growth hormone has an impact on the bones, and the growth is mediated via somatomedin via liver. Prolactin has an impact in the synthesis of milk, ovaries, estrogen, and progesterone, that is mediated through LH. LH mediates the secretion of estrogen and progesterone. Follicle stimulating hormone has an impact on the testes to release the testosterone, and even the synthesis of oocytes. Adrenocorticotropic hormone releases adrenal hormones. TSH releases the thyroid hormones. Okay. Posterior, it is on the kidney glands and also on the uterus. Okay. Intermediate lobe, melanocyte stimulating hormone has an impact on the skin via melanin. Okay. Just to go through this slide, then I'll just move to hypothalamus. This pituitary gland is a little tricky or a little difficult, but in the further slides, it's a little more simpler. So here, the genital or the ovaries and testis and mammary glands is over. So and uterus, I'm not dealing that, or I'm not explaining that in detail. So today we'll be studying in detail thyroid, pancreas, thymus, parathyroid. Okay, and one left out will be adrenal glands. Okay, that I will continue in the next class and go to the next topic. Okay. So if this slide is clear, I'll just go back to hypothalamus. So again, hypothalamus controls posterior pituitary. So in posterior pituitary, we have 2 hormones, antidiuretic hormone and oxytocin. They are transported by means of exonic and exoplasmic flow. So this, let me not tell you. So hypothalamus controls posterior pituitary. Posterior pituitary, if hypothalamus gives a signal to release, then it releases ADH and oxytocin. Okay. Next, hypothalamus has 7 hormones. Hypothalamus itself has 7 hormones. So what do these hormones do, or what are those first? So growth hormone releasing polypeptide. Okay. So just remember GHRH and GHRP. Okay. They have an action on the growth hormone. If GHRH and GHRP are activated, then only growth hormone is released from anterior pituitary. Thyrotropic releasing hormone, TRH, has an impact on TSH, which is present in anterior pituitary. Assuming end organ is thyroid organ or the thyroid gland. So thyroid gland has T3 and T4. Thyroid gland has T3 and T4. Now for T3 and T4 to release, TSH has to release. For TSH to release, TRH has to release. Okay. So first step TRH, then TSH, then T3, T4. Okay. TRH, TSH, and T3 and T4. So thyroid releasing hormone, thyroid stimulating hormone, and tetraiodothyronine and triiodothyronine. That's nothing but T3, T4. Next, we studied about adrenocorticotropic hormone. So again, that switch is here. Corticotropin releasing hormone. Okay, gonadotropin releasing hormone. Gonadotropin releasing hormone, it is got to do with the estrogen, progesterone, testosterone, etc. Okay, growth hormone inhibiting hormone, that is a somatostatin. So we came across somatomedin from the liver. Okay, somatomedin helps in growth. Somatostatin helps in making the growth static. Okay, so we have GHRH and GHIH, growth hormone releasing hormone, growth hormone inhibiting hormone. So we all have a good stature. That is because our GHRH, GHRP, and GHIH are normal. If the GHRH, GHIP were a little variant, then we would have come into the categories of the variants. What were the abnormalities? The abnormalities what we have studied. That is, can anybody tell me? We studied 3 abnormalities with respect to growth hormone. No? Gigantism, dwarfism. Yes. So these abnormalities would be the effects of any malfunction in the secretion of these. Next, prolactin inhibiting hormone. Yes, good. Prolactin inhibiting hormone. Okay. So when we see one thing, anterior pituitary lobe has 2 anterior pituitary has 6 hormones. Posterior pituitary has 2 hormones. Intermediate has 1 hormone. So here hypothalamus, the master gland, has control of various glands, and it is having 7 hormones. Among 7, there are 5 releasing. Or it releases, and there are 2 hormones which inhibit, which stop. So there are 2 hormones which stop is growth hormone inhibitory hormone, prolactin inhibitory hormone, GHIH and PIH, growth hormone inhibitory hormone, prolactin inhibitory hormone. They are transported to the anterior pituitary via hypothalamo-hypophyseal portal blood vessels. Ignore this. So these hormones have a control over anterior pituitary. When these have an impact on anterior pituitary further signals the concerned hormone to work on the next system. Like we will take example of prolactin inhibiting hormone. So PIH will have an impact on the prolactin. If PIH says do not, or PIH sends a command to the mammary gland, do not further secrete prolactin. When prolactin is not further secreted, then there is less formation of breast milk. Okay. So pituitary is the master gland, but its functions are controlled by the hypothalamus. So if we see these in an order, it is hypothalamus, pituitary, and after pituitary is the concerned glands. It may be the bones, it may be the thyroid gland, it may be the adrenal gland, etc., or the gonads. I have put one slide of prolactin. Let's see if it's there in the future. Okay, next coming to intermediate lobe, it's secreting only one hormone, that's melanocyte stimulating hormone. So This is, I told you, it is basically in relation to the melanocytes and melanin. Okay, we studied when we were studying about skin, we studied about keratinocytes, keratin. So I told you that keratin based shampoos are coming up these days. So there are alpha melanocyte stimulating hormone and beta melanocyte stimulating hormone. They stimulate the production of melanin by melanocytes in skin and hair. Okay, so few of us are getting a gray hair. Assuming few are getting a gray hair. Why is somebody getting a gray hair? It is because of the reduction of melanin, and this melanin is under the control of melanocytes. Melanocytes stimulating hormone is present in the intermediate lobe of pituitary, and it also has an impact on the sexual arousal. Next, coming to posterior pituitary. So just a quick revision: anterior pituitary 6 hormones, intermediate pituitary 1 hormone, posterior pituitary 2 hormones. Okay, so 2 hormones basically oxytocin and vasopressin. Okay, vasopressin also has called as an antidiuretic hormone. Okay, antidiuretic hormone. So this vasopressin or the ADH has 2 important functions, that is to retain water in the body. Okay, water retention is done through ADH. Water retention is done through ADH. When we are studying about hypertension or some renal pathology, it is through ADH. Next, to constrict blood vessel. To constrict blood vessel. Okay, it helps in narrowing the blood vessel. It helps in narrowing the blood vessel. That is the ADH. Okay. Next, oxytocin, action on mammary gland, ejection of breast milk. Ejection of breast milk. So I asked you, and few of you attempted the right answer. Ejection of breast milk. Action on uterus, contraction of smooth muscles to help in the labor. You might have come across anybody undergoing normal labor, they inject you with something. It is nothing but the oxytocin injection, so which helps in contraction of uterus. If there is good contraction of uterus, then that will help in proper delivery of the baby, parturition. That will help in proper delivery of the baby. So oxytocin has an impact on mammary gland and also on the uterus. See, its oxytocin is basically to throw out something or to leave out, to emit out. It helps in the emitting of the breast milk. It helps in the emitting of the fetus out. Okay, oxytocin is basically like got to do with the parturition, that is expulsion of the baby from the womb, and it has an impact on the mammary glands, that is to eject the milk to the mammary gland. Okay. So yeah, this was a slide I was heading. So for the breast to secrete the breast milk, okay. So once there is suckling reflex from the baby, then posterior pituitary gets a signal. Posterior pituitary gets a signal that baby is sucking, so milk has to be ejected. So this ejection of the milk is under the influence of oxytocin. Okay. And for this ejection, that it is under the influence of oxytocin. Next, for it to be ejected out, the milk has to be formed. Okay. For that milk to be formed, it is prolactin, which is from the anterior pituitary, which is involved. And for the prolactin to be released, so that prolactin inhibiting hormone should not be functioning. Prolactin inhibiting hormone should not be functioning, or should be in its normalcy. So prolactin, it is secreted, which will cause the milk production, and oxytocin will help in the ejection of the formed milk when there is sucking reflex by the baby. Okay. Next, so this completes the glands of the head. Now moving on to the glands that are in the neck region. So important of those all glands is the thyroid gland. Thyroid gland is a butterfly shaped structure which is present in the anterior part of the neck. You can see this red structure. This red structure is nothing but the thyroid. Okay. It's a butterfly shape. So this thyroid gland is situated in the neck, in front of the larynx and trachea. It weighs about 25 grams. So just imagine your 25 grams. It looks like a butterfly, consists of 2 lobes joined by isthmus. Okay. You can just get this in the subconscious mind. Okay. Important, T3 and T4 hormones are secreted from thyroid gland via the signals of thyroid stimulating hormone. via the signals of thyroid stimulating hormone. So see there, T3, it has effect on almost all the physiological processes in the body. So physiology is always the normalcy. Physiology is always the normalcy. Can somebody tell me what is pathology?
Blood test?
Very good. Who is this? Your answer is right. Let me know who it is.
Daksha. Daksha.
Daksha. Very good. I appreciate your yes. Pathology is got to do with the blood test. Now I have a question. Why do we do a blood test? Why do we do a blood test? Anybody? Okay, why do we go to a pathology lab then? Simply like how you go to shopping. Chalo, we will just go once and come back. Do you go like that to a pathology lab? Okay, check normal parameters. So anybody who has an abnormality, or we go to a pathology lab to check any abnormalcy to test a disease. Yes. So yes. So pathology is the abnormality. I've always told you this. Physiology is the normalcy. To go and check the abnormalities, to go and check any diseased condition, we are going to a pathologist or to the pathological laboratory. Physiology is the normal functioning. So the triiodothyronine or the T3 has an impact on the almost all the physiological processes, on all the normal functioning of the body. What does it do? Growth and development, metabolism, it helps in the digestion, body temperature and heart rate. These are very few. It has many other things. T4, tetraiodothyronine or the thyroxine, controls development and maturation. Excess thyroxine releases rapid development. So there is the abnormal growth. Deficiency of thyroxine results in delayed development. 2 to 4 TSHs, you may have increased body temperature, feeling of fatigue. I'm explaining this because you may come across these. Okay, there may be a weight gain, weight loss, or loss of hair, or growth of hair, or there is increased heart rate, reduced heart rate. You keep feeling hungry very much, or you may have loss of appetite, you may have constipation, etc. Okay, so on different systems, it's impact. Next, calcitonin is again another hormone released by the thyroid gland, by the C cells. It is mainly to increase bone calcium and to decrease blood calcium levels. What it does is, in the blood, calcium is there. That particular calcium is absorbed and taken to the bone. So it does both. It takes up the calcium present in the blood and puts it into the bone. That's an important function of calcitonin. Okay. Then it has an opposite function with the parathyroid hormones. We will read that in the next slide. You can go through that simple. Okay. So how is thyroid gland under control? So hypothalamus has to release thyroid releasing hormone. Okay. Hypothalamus has to release TRH. That's the thyroid releasing hormone. Once TRH is released, pituitary gland will release TSH. Question at this level, TSH is secreted from anterior pituitary or posterior pituitary or intermediate pituitary. Who will answer it first? TSH is secreted from dash pituitary gland, dash lobe of pituitary gland. Which lobe?
Anterior.
Okay, good. I got two simultaneous answers, Saisha and someone who is
Daksha.
Okay, Saisha and Daksha. Okay, please creatively applaud them. And this is Daksha's second answer. Your friends are a little cunning or a little stingy. Okay, Karan is not stingy. Nivedita also is not stingy.
Thank you.
Okay, yes. So TRH will release, and that in turn will release TSH from the anterior lobe of pituitary. And when TSH is released through the thyroid gland, T3 and T4 are released. When these are released, again they are taken up, or they are peripheral tissues, to the tissues it is taken back. So let's not study about the feedback mechanism, but just to understand how it's regulated. So when, like, when T3 and T4, it's just like your stepwise procedure. You want to prepare some food. First, you need to have your vegetables in the refrigerator, take that out, wash it, chop it, and then the final dish is prepared. So for everything, you need some preliminary preparations. Okay. So hypothalamus, pituitary, and thyroid. So for one thyroid gland to function, it is having another two glands which have to function. So whenever somebody has a thyroid issue, does not mean it is just with the thyroid gland. It is the blessing that it is if it is only with the thyroid gland, because thyroid is under the control of pituitary, pituitary is under the control of hypothalamus. It's a chain of it's a chain like link. Thyroid interdependent on pituitary, pituitary dependent on hypothalamus. Okay. Now, what are the conditions with respect to the thyroid? So one is the goiter. Goiter is a condition where there is swelling in the neck. This for the swelling, which will have an impact on the structures behind. It will have an impact on the structures behind, and hence there is change in the voice because there is larynx present. It will affect the larynx. Okay, hence there is hoarseness of voice because it's affecting the pharynx, oropharynx. We studied oropharynx, larynx. So because it's having an effect on those, there is difficulty even in swallowing. There's difficulty even in swallowing. Okay, it also causes certain breathing abnormalities. This goiter is nothing but the swelling of the thyroid gland, which you can prominently see here. Okay, this is not Adam's apple. This is not the normal. This is abnormal swelling. It's a female. It's an abnormal swelling in the neck. It's an abnormal swelling in the neck. It's an abnormal swelling in the neck. This is the enlarged thyroid gland. Hypothyroidism. When T3 and T4 are reduced, then it is called as hypothyroidism. When T3, T4 are reduced, it is called as hypothyroidism. Okay. So hypothyroidism is basically got to do with the this thing. There is weight gain, swelling of the face, swelling in the eyes, etc. So I'll just read. Goiter is one of the presentations seen in hypothyroidism. Puffiness of face with periorbital swelling. Puffiness of face. Face looks to be a little swollen and periorbital swelling. Okay. Just remember these. This periorbital swelling, it's not necessarily that present only in case of thyroid. It's even present in the cases of kidney diseases. It's even present in the cases of kidney diseases. Loss of scalp hair. Loss of scalp hair. I told you, hair loss. Ptosis, drooping of upper eyelid. Ptosis. So it's just like you blink your eyes. Person cannot open. It suddenly droops. It falls on its own. Drooping of eyelids. Dry, thickened, rough, and yellow skin. Okay. So the highlight here is hypothyroidism is caused due to reduced T3, T4 levels in the circulating blood. Okay, another condition which is not mentioned here, hyperthyroidism. More amount of T3 and T4 will be under the heading of hyperthyroidism, wherein there will be tremors. There will be tremors. Their hand will be shaking. There will be tremors, and there will be weight loss. Okay, person will be constipated. He will be looking very thin, dry, rough skin, etc. Dry, rough hair, brittle hair, etc. is presentation in hyperthyroid. Of late, what we can see, like among many patients of thyroid abnormalities, considering hypo and hyperthyroidism, many of them are hypothyroidism. People suffering from hypothyroidism. Yeah. Next, coming to parathyroid glands. So I told you about neck structures: thyroid, parathyroid, and thymus. So parathyroid glands. There are 4 parathyroid glands. So this structure is nothing. This structure is nothing but the thyroid gland. This whole thing is the thyroid gland. This is the posterior view. This is the back view of thyroid gland. So in the back view of thyroid gland, we have 4 structures. So they are called as parathyroid. They are called as parathyroid glands. Parathyroid glands contain chief cells which secrete parathyroid hormone. The main function of parathyroid hormone is to increase blood calcium level. So I told you this when I was talking about calcitonin. When I was talking about calcitonin, I told you it is contradictory. What does calcitonin do? There is calcium present in the blood. It will take it from the blood and put it into the bones. So that is taking away the calcium. So here what it is doing, it is increasing the blood calcium level. Okay, that is parathyroid hormone is putting calcium into the blood, and calcitonin is taking the calcium away from the blood. Okay. This is of parathyroid gland. It is usually seen in rickets. It is usually seen in children. Okay, it's called as rickets. So if you should just recall your ribs. There's something called as a costochondral junction. So here is the sternum. The center part is the sternum. Okay, via the cartilage it joins to the bone. Via the cartilage it joins to the bone. So here is the costochondral junction. There you will see beaded appearance. So that is the beaded necklace appearance. So here it says bony necklace appearance. Okay. Okay, you can see here bowed legs, big joints, curved bones, etc. Bowed legs. There is legs become like a bow. Legs become like a bow. The joints appear to be looking big, curved bones, etc. Next, osteomalacia. It is inadequate absorption of calcium due to deficiency of vitamin D. Due to deficiency of vitamin D, there is inappropriate absorption of calcium. So calcium which is present in the blood, that's not absorbed properly. Then it causes osteomalacia. Next, hypoparathyroidism. So hypoparathyroidism is basically due to low levels of calcium. So we read parathyroid hormone's main function is to increase the blood calcium levels. But here, when it is hypo, when it is functioning less, then it is low levels of calcium in the blood. So what it causes? It causes paresthesia, that is abnormal sensations, psychiatric disturbances, psychiatric illnesses, development of cataract, early cataract in hypoparathyroidism. Next, hyperparathyroidism. Excessive secretion of parathyroid hormone. Formation of renal calculi. What happens when there is hyperparathyroidism? There's more amount of calcium. So when there is more amount of calcium, it is let out via urine. When it is let out, what it is doing? It is not coming out. It is forming calcium stones in the urine. It's forming calcium stones in the urine. There is polyuria. So there is polyuria. When there is hyperparathyroidism, there is more amount of frequency of urination. There is more amount of frequency of urination. When a person is passing too much of urination, there is high chances that he will feel more thirsty. Okay. So next immediate presentation is polydipsia. Polydipsia. He feels like drinking lots of water. Why is he drinking lots of water? Because he's urinating too much. He's urinating too much. Anorexia, loss of taste or not feeling hungry, muscle weakness, general fatigue, calcification of soft tissues. Calcification of soft tissues, another important thing. The calcium is more. So that calcium is getting deposited in the soft tissues. Moving to important structure. Okay. So there are many structures here. Which is the structure we will be concentrating today with respect to endocrinology. First, tell me it is part of which system? Respiratory, digestive, excretory?
Digestive.
Digestive, very good. So it's a part of digestive system. You can see a few parts being labeled here. So among this, which is an endocrine and an exocrine gland? Yeah, digestive, correct answer. So among the various glands I told you we are going to study. So here in this image, you will find one particular structure which is both endocrine and exocrine in nature. We are going to study about such gland. Karan says pancreas. I don't agree. Saisha also says pancreas.
Liver.
Liver. Okay. Anybody else?
Liver included in exocrine gland.
Very
Also,
good. Very good.
Yes.
Very good. Who is
And
this?
Daksha.
Very good. Daksha. Yes. Good. Good. So yes. So your friends Karan and Saisha are correct. We are going to study about pancreas. Okay. So pancreatic hormones, basically insulin, glucagon. Okay. Basically, we'll be studying about insulin and glucagon. Among that, it is the insulin. Okay. So we'll just see the actions, what it does. Insulin has an impact on carbohydrate mechanism. That is, insulin increases the glucose entry into most of the body cells. Insulin produces hypoglycemia. See, assume blood is having too much of glucose. So blood is having too much of glucose. That glucose has to be used up, or that glucose has to be taken up. I told you there in the previous condition, blood is having too much of calcium. So that calcium in the blood is taken away by calcitonin. So similarly here, in the blood there is glucose. That particular glucose is taken up by the insulin. Insulin is helpful to take away the excessive amount of sugar or the glucose present in the blood. So when it takes away the glucose from the blood, then it causes hypoglycemia. Hypoglycemia. Next, on protein metabolism, it decreases protein breakdown. It decreases protein breakdown, rather it causes protein synthesis. It helps in the formation of protein and helps in the uptake of glucose, helps in the uptake of glucose. So what is the disease in relation to the metabolic disease? Is a group of metabolic diseases in which there is high blood sugar levels over a prolonged period. So an important three important findings what we see here: polyuria, polydipsia, and polyphagia. Three polys. Polyuria or three P's: polyuria, polydipsia, and polyphagia. So there is increased. Before I tell, I'll just move this. If anybody of you have come across diabetes patients.
Yes, ma'am.
Okay, what are the symptoms that they would express, or what made you to take them to the hospital?
Yes, ma'am. Craving of sweet,
Very good.
swelling.
Smell, yeah, smell in the sweat.
Yes.
Yes. Sweat.
Yes,
Yeah.
and urine.
Okay, increased urination. Very good. Okay, anybody wants to add on? Just think, if the person is urinating more, what will be the other presentation?
He'll be more
Thirsty.
Feeling
thirsty.
thirsty.
Very good, very good. Applause to all those who answered. Yes, excellent. So, yes, your friends have rightly told three important findings that we would see in diabetes mellitus is polyuria, increased frequency of micturition. So, increased frequency of micturition is person will have or do multiple urinations. Increased thirst. He will be feeling more and more hungry because he is urinating more and more. And the person also will have increased hunger. There will be too much of hunger. He feels hungry a lot. So these are three presentations which we come across in diabetes mellitus. And your friend told about odor from the body and told about too much of sweating. All that is accepted. They're all the findings. Next, coming to another hormone secreted by pancreas, that's the glucagon. Glucagon acts mostly on the liver and adipose tissues, where it antagonizes the action of insulin. So it is opposite to the functions of insulin. What does it do? It stimulates glycogenolysis and promotes gluconeogenesis. So what is insulin doing? It is taking up the sugar levels. Just give me a minute. I will come back. सिर्फ यहाँ पे हाँ और बाद में दरवाजा बंद कर कैसे हो ठीक हो Okay, so it is glucagon is functioning opposite to the functioning of insulin. Next, another hormone, somatostatin. It regulates the endocrine and nervous system functions. So this hormone especially has an impact on the hypothalamus and the pancreas. So it has an impact on the endocrine gland and the nervous system. Okay. Thymus, which is present at birth and in childhood, and it tends to become a vestigial organ or tends to be less functional in the elderly people. It goes off by the childhood. as the person grows, it reduces itself, or its functioning also reduces. So thymus is located in the anterior part of the upper mediastinum. In the anterior part of the upper mediastinum. Mediastinum is the space in between the two lobes of the lung. Okay, so here. Thymus gland. Okay. At birth, it weighs 10 to 12 grams. During childhood and adolescence, 20 to 30. During old age, it becomes 3 to 6 grams. So, important thing about thymus is T lymphocytes. Of late, due to COVID, we are worried about immunity. Okay, so in children, it is through these T lymphocytes which are secreted from the thymus gland. They help in maintaining the immunity. Okay, it is required for the development of T lymphocytes for cell-mediated immunity. There's something called as a humoral immunity and cell-mediated immunity. So basically, the thymus gland present in children is helpful to maintain the immunity of the children. Okay. Yeah. Thank you. So today, one system that we have excluded is the suprarenal glands. The suprarenal glands, and rest, even like coming to the genitourinary, or the systems like ovary and the testis, that we have actually covered in the this thing when we were studying the genitourinary system, okay, or the reproductive system, and that we have come across those. So an gland that is left to be explained is the adrenal gland or the suprarenal gland.
I have one question, please.
Yeah, please.
I didn't get that. Which is that gland which gives white spots?
Okay. Melanocyte stimulative hormone is a hormone secreted by the intermediate lobe of the pituitary gland. Pituitary gland releases MSH, melanocyte stimulating hormone. Okay, this melanocyte stimulating hormone has an impact on the skin. How it secretes, or it helps in secreting melanin. When MSH is not triggered, it will not secrete melanin, and hence people will have white spots.
Can you write the spelling over there? Which the name of the gland, please?
It's an intermediate lobe of pituitary gland.
This is the intermediate lobe.
Yeah.
But you said some another name, no? Mellitus, what you said?
Melanin. Melanocytes.
Oh, okay, yeah.
MELANIN.
Okay. Thank you. And can a person who has lots of these white spots, can it recover?
See, it depends. It comes under the heading, or it comes under the disease called vitiligo. Okay, so there are a few practitioners, it's a kind of, we have classifications of diseases wherein some diseases are incurable or curable with difficulty. Okay, in that kind of the classification, this vitiligo comes. If vitiligo is not in these areas, like see here, so this is the dorsum of the hand and this is the palm. Here, if there is, the lesion is begun here in this area, if the lesion has begun, or if the lesion is on oral cavity, okay, in that conditions, or if the hair of the body is supposed to be dark, or it's the black color, if the hair also has become white, then it is incurable, or it is curable with difficulty. Very, the chances will be just 10%. But if it is just one spot and has not begun on the lips or these areas, then it is can be managed. And in allopathic side also, they have punch therapy, etc. Okay, so vitiligo can be managed when the lesion is small, when the onset is in young age, and the hair haven't become white, and it is not spreading in nature. It is just one white with the difficulty give you treatment. But if the large area, if it is widespread, if it is widespread over the large surface of area, it may be as big as 2 palm size. If it is as big as 2 palm size, like, this whole hand being involved or the whole abdominal area being involved, very difficult for giving results. Very difficult.
And if this comes, can we bring a change in the food if there is a small spot?
The food.
Does the food affect this?
To some extent, I okay, ma'am, does this disease cause danger to the life? I'll get back. No, yeah, see, if you consider the allopathic side, I don't think they consider food as the cause, but I, being an Ayurvedic doctor, I consider food as being the cause. In my previous class, if there are a few students who attended my Ayurveda sessions, wherein I told them that in Viruddha Ahara concept. So while telling about Viruddha Ahara concept, it is the of late what we are always advising our patients with vitiligo is not to have banana with milk. I don't know, it's present in the places where you all are, but it's prevalent in South India, and especially in Karnataka, where we have the practice of eating banana, milk, and sugar. And we totally ask them to avoid banana and milk. And also, of late, what we are advising our patients is to avoid anything that is white. Anything. It may be the bread, it may be the wheat atta, it may be maida, it may be rice, everything we are asking them to avoid.
Avoid. Okay.
Okay.
And one more question. Is it pitta related?
If you talk about pitta, there are 5 types of pitta. Among them, it is in relation to Brajaka pitta.
Okay.
Any skin disease is in relation to Brajaka pitta.
Okay. Thank you so much.
Welcome. So one of your friends asked me, is it danger to the life? It is not having any, it does not cause any harm to the life. It is just for the cosmetic purpose that the patient, it is not appealing to the viewers. It is not life-threatening. There is no internal abnormality. There is no internal abnormality. Example, when it is diabetes mellitus, there is increased secretion of insulin, or a person is sweating too much and urinating too much. Yes, it is life-threatening there. If you further continue it, then you may land up into you may become unconscious and you may fall off because of reduced blood sugar levels, etc. But this does not take away your life. It is just the cosmetological problem.
And one more question, sweating is important?
Very much, very much. It is through sweating that your skin remains healthy. But for obese tend to sweat much, but people who are obese tend to sweat much. And you see, anything has to be in normalcy. If you're sweating too much, that's also abnormal. You need to find out why. Okay, sometimes in diabetes mellitus, sometimes in obesity, and sometimes you sweat which is normal after an exercise.
Because I am pitta dosha, so I'm like studying all this, and I'm drinking coriander water. I blend the coriander, fresh coriander leaves with water and blend it and drink it every morning. This is my drink in summers.
That's good.
But it is helping me a lot in my digestion, in my skin, many things. It's helping me.
Good, good. That's actually, that suits you, so you're doing it.
Yeah, that suits me. I've avoided dairy now because we are not getting pure milk. So I've avoided like drinking milk or tea in the evening. I've avoided many things from my life because as the age grows, then we have lots of imbalances. So I think so better to control over the food and lifestyle. It's much better.
Yeah, very true.
Yeah.
Yeah.
Okay, then anyone questions?
Sir, yeah, I'll say something. So whenever we are doing deep relaxation techniques, or when we are doing asanas like the headstand, it's that Shirshasana, right? So Shirshasana, etc. So it is whenever we are doing Shirshasana, there is an increased blood supply to the brain. This increased or enhancing the blood supply to the brain will in turn have an impact on the hypothalamus and pituitary. The other understanding is when you're doing the DRT, deep relaxation technique, that time also it is having an impact on the pituitary.
Okay, thank you, ma'am. And अभी और किसी का कोई क्वेश्चन बाकी है? So,
Thank you so much.
okay.
Welcome.
No questions. Okay, ma'am.